Very good evening for today. Welcome to all of you, my beloved colleagues.
Okay, a man with 2 to 3 weeks of altered level of consciousness. He has a history of recurrent alcohol withdrawals. The diagnosis is
The loss of consciousness. What's the diagnosis? Was it Korsakoff
chronic
or alcohol withdrawal syndrome?
Paracetamol.
Korsakoff encephalopathy.
Yeah,
But can alcohol withdrawal syndrome patient have loss of
If
consciousness?
it was having a course of cough, then there will be a balance problem and ataxia and diplopia. So
Could be
it's
there, could not be there, but due to altered level of consciousness. Loss of consciousness more in favor of encephalopathy or withdrawal?
I think encephalopathy.
Encephalopathy due to thiamine deficiency.
Yes.
In addition, remember whenever this situation happen during the management, we have to give thiamine as well as glucose together. Okay, patient will have hypoglycemia also. There is other reason of unconsciousness. So if we correct the glucose, and thiamine deficiency will be more and more if I don't give thiamine together. So first priority is the thiamine plus glucose in emergency situation. Clear, doctor?
Yes.
Especially in alcohol diseases. Thiamine. Thiamine can be given in routine also, those who are chronic alcoholic. Okay, next question.
Child with ingestion of paracetamol 100 ml 8 hours ago.
Actually,
Weight
1000 milligram, I have discovered it in the standard composition. 100 ml means 1000 milligram. That is 1 gram.
the most appropriate management.
What will you do? Was there any symptom or not? I don't know.
It was not mentioned any symptom, I think.
If you go through the paracetamol poisoning, what is the toxic level? We must know. Usually 10 gram. Usually 10 gram. Until 4 gram, there will be no problem. Okay, after 4 gram, if patient have the comorbidities and others, then there may be problem. So in this respect, there is only 1 gram. If it is so, what is your decision?
Reassure only.
Yes. I don't know, somebody discussing in the group and acetylcysteine and acetylcysteine. I'm sorry to say I don't agree with this. Okay?
Yes.
The 8 hour. Usually this paracetamol level in the blood is measured after 8 hours. There's some other issues also. It is called staggering of the dose. So it's complicated a little, but for the AKT, simply 8 hour measured the paracetamol level, and if it is more, then but not this one. Can anybody add here, doctor? At the after the 8 hour, if it is ingestion of 1 milligram, doctor, not mentioned is a blood level. Remember, okay, blood level will be different. Okay.
Yeah.
So if it is ingestion of the 1 gram only, at the end of 8 hour, what will the problem? Usually we advise in the adult people 1 gram 4 times daily every 6 hour, right? Can you
Yeah.
remember?
Yeah.
So
Yeah.
these very tricks, very simple tricks. And 1 ml means 520 TSF, right? 100 ml is 20 TSF. And 1 TSF, how much it is? It depends upon the preparation country to country. Anyway, apparently it is a very less dose to create any toxicity. So don't worry.
Okay.
Then
Lady with shoulder joint pain, painful at 60 to 99 degree abduction. The diagnosis is
what? The common shoulder problem is the frozen shoulder, but there is any other thing?
rotator cuff,
Rotator cuff, what? Rotator cuff tear.
tendinitis,
Rotator cuff tear. Rotator cuff tendinitis. It is called the shoulder impingement.
yes,
Another one is a painful arc of the shoulder. Painful arc. But in adhesive capsulitis, in all directions, there will be pain,
Yeah.
full range. So it is very common question. Not only AKT, it will be in the OSCE also, this differentiation. Adhesive capsulitis or the impingement. Next
So
one.
what would be the answer here, sir?
Impingement. Impingement I have written here. But the rotator cuff tendinitis, maybe there was option in the exam. It's the same thing.
Okay,
Rotator cuff
yes.
tendinitis is the impingement. Next. Please, Doctor, carry on.
Sorry, sir, I have a call. Can
Okay,
someone
okay.
else, please?
Someone else. So let me say, if someone is not proactive, sorry to say, child with bronchial asthma presented with aggressive behavior, maybe some medication given, inhaler, steroid, montelukast, and others. So what is the reason? Aggressive behavior. Can anybody say? Dr. Abdullah, always silent.
So
Others.
there was confusion in choosing the answer
This
because
is the answer. This is the answer, Doctor. Montelukast can cause aggressive behavior.
and also insomnia.
Could be. Those who are having aggressive behavior, they may have insomnia also. But I think aggressive behavior is the key word here. Aggressive behavior is the key word here. We have to
And
be alert because we are
why not salbutamol? Because salbutamol also beta agonist
yes,
cause
but it can cause, but the more common cause will be montelukast in the pediatric group, especially. Okay, doctor. Montelukast could be the single best option.
Okay.
So this is the scenario based, but I have some other short messages collected. I don't know, do you agree with me? From the group, I have collected the message. LADA treatment. Was there any question? LADA treatment? What will be the LADA treatment? What is the LADA? Latent onset autoimmune diabetes in adult. Latent autoimmune diabetes in adult. Adult means a little advanced age, but autoimmune diabetes. Autoimmune means actually meaning type 1 diabetes, where insulin deficiency is there. So treatment will be the insulin. Doctor, okay? Do you understand my point? Sorry, anyone, please. It needs interaction.
Yes, doctor.
It will be the insulin.
There was an elderly man with polydipsia, polyuria, and weight loss.
Okay. Elderly
So
means too much aged or younger? 20, 30?
48, I think.
48? No, usually LADA happen around 30. 30.
Okay, I
And
don't sure.
just
Not
let me
sure.
say something for your future also. They usually patient we advise oral medication. Suppose it is not younger, after 20s, around 30, 25, 28. But few months later, you will find that diabetes is uncontrolled. Patient is still symptomatic, even 2, 3 drugs. Then we need to suspect this is LADA. It means patient needs insulin now. So it is also insulin dependent diabetes. It is exceptional. Similarly, opposite picture is MODY, MODY. Maturity onset diabetes in young. Now you understand the difference. Next one. Any question about poliomyelitis, doctor? I don't know. Someone said no LADA question. Anyway, let us know. It will be useful for you. Any polymyelitis question? If not, baby nipple discharge. Maybe
It was
immediately.
polymyositis. Question was about polymyositis.
That, yeah, that was about the diagnosis.
Yes, polymyositis, a case of a lady with similar picture as polymyalgia rheumatica with temporal arteritis, but was weakness and creatinine level was high.
Oh, so polymyositis. That's good. There may be proximal weakness also, right? Lower limb, upper limb. But polymyalgia rheumatica usually predominantly affect the upper limb in the elderly patient. There, okay. Next, baby nipple discharge. Maybe a newborn baby. Again, interesting question could be there. Newborn baby nipple discharge due to excessive hormone in the baby's body. It will be okay in course of time. So reassurance may be the answer here.
Reassurance, yeah.
Estrogen will persist in the newborn baby. Then supraclavicular lymph node related, any question?
Yes, gastric carcinoma. It was a question
Oh,
related
gastric
what
carcinoma.
pregnancy.
Maybe
Yes, what pregnancy is
maybe
related.
option endoscopy or ultrasound. If it's a gastric carcinoma,
Ultrasound.
endoscopy will be the answer, not the ultrasound.
Why?
Because commonest cause is the gastric carcinoma. So a gastric carcinoma will be diagnosed by endoscopy doctor, not ultrasound. Ultrasound cannot identify the malignancy well. You can say
Okay.
technically another thing. Ultrasound guy, the endoscopic ultrasound. This is a separate thing, a specialist talk. But as a GP, we cannot think of endoscopic ultrasound. We are thinking endoscopy. If option is endoscopy there, definitely answer will be the endoscopy of upper GI. Okay? Endoscopy upper GI. But somebody answer maybe ultrasound. For that, I got the message endoscopy. I was not sure the complete message. Supraclavicular lymph node. Was there any other symptom? Maybe abdominal or dyspepsia or weight loss? Maybe there. And then correct answer will be endoscopy. But abdominal malignancy can cause supraclavicular. If it is the left side, it is called the Virchow's gland. More likely gastric malignancy, endoscopy. Then gastroparesis treatment there, anyone? Usually happen in the diabetes, autonomic complication.
Domperidone was written, I think.
Doctor answer will be erythromycin. Erythromycin. If diabetic gastroparesis, erythromycin. But in general, domperidone will be prokinetic drug. But if diabetes gastroparesis, answer will be erythromycin. Exceptional use of the antibiotic. Next one, diabetes and heart failure.
DAPA, glyphosine, SGLT.
No, SGL2.
SGL2 inhibitor. SGL2 inhibitor. Not only heart failure, ischemic heart disease with diabetes also. Even without diabetes also. Remember, without diabetes also, this heart failure and the cardiac ischemic heart disease also, we can advise for the better benefit in future, SGL2 inhibitor. Remember it. Without diabetes. Old patient, altered bowel. So old patient means always dangerous diagnosis. We have to exclude. So what the management or further evaluation?
Endoscopy, I think.
That means the colonoscopy. Yes, colonoscopy. Cold sore. Was there any cold sore question?
Yes, herpes labialis.
So treatment maybe it is a treatment or diagnosis.
I think so. There was a picture.
I don't know, doctor. Was there any picture or not?
There was one case to
Picture.
diagnose herpes labialis, and there is a photo. Treatment is asexual.
Oh. Anyway, we hope to show you the picture, inshallah, in the coming session. Don't worry. Regarding many, I don't know, was there any picture? I will add it. Otherwise, I have collected some pictures also. Cold sore, acyclovir cream. Okay. Child tremor. Was there any question? Child tremor? Was there jaundice? Child tremor and jaundice?
Not remember.
I don't remember. Yeah.
I don't remember. So somebody wrote there. Somebody said it's a valproate. I am confused. Just for your understanding, child means younger age. Tremor with jaundice, it may be Wilson's disease.
No, it was a question about jerky movements. A child with absence seizures and having a one episodic jerky, I think is like this. And what is the treatment?
Was it febrile seizure? What do you think? Was it febrile seizure? Because first seizure doesn't need medication.
Yes.
Evaluation is important. First seizure. So first seizure means referral to the pediatrician. It is the answer. Straightforward. Okay, not the valproate. Refer to pediatrician. It may be the answer. I don't know what is the option there, written or not. Pediatric. Any seizure. It is an febrile seizure or non-febrile seizure. First seizure. But second or third febrile seizure doesn't need referral because you already understood this is a febrile seizure. Technical informations. Any JRA, juvenile rheumatoid arthritis, or
Yes, that
JIA?
was,
Actually, it will be JIA, juvenile idiopathic arthritis. Was it
yeah,
diagnostic question or therapeutic question?
no, diagnostic question.
What was the option there? I don't know. But interesting thing to share is negative. Negative autoantibody in the juvenile. All antibodies are negative. Okay. There may be other diagnoses, still disease, different types of JIA. What type I am not sure. But what is the common one is
There
the
was a
systemic
fever,
on system.
for the last 2 months, I think.
Okay,
There was
there
a
may be fever, there may be high ferritin, there may be swinging fever, right? Lymphadenopathy, organomegaly, serositis. So these are in favor of still disease. And still disease may happen in the adult also. In adult medicine, we say adult onset still disease. But interesting thing is autoantibodies are negative. Autoantibodies are negative. Okay. So up to this doctor in my hand, and gratitude to all of you. I am inviting to you for this group.